Good afternoon, and thank you so much for joining us. I'm Lydia Colbita.
And I'm John Gray. We're so glad you're with us. More than a year after accusations and allegations first came to light, accusing New York State officials from purposefully and deliberately undercounting the number of nursing home residents who died of COVID, a new report confirms they did just that.
The report referencing decisions made by the administration of former Governor Andrew Cuomo. News 10 ABC Capitol correspondent Jamie DeLine speaking today with the comptroller about what this means for New York State moving forward.
New York State Comptroller Tom DiNapoli tells me he isn't surprised with the audit's findings, but is disappointed that it confirms the feelings of so many people who lost loved ones. The comptroller's audit finding that the New York State Department of Health underestimated nursing home COVID deaths by 4,100, and at times more than 50% during the pandemic. It adds DOH was unprepared to respond to infectious disease outbreaks in nursing homes even prior to the pandemic.
Relatively early on in the pandemic, the Department of Health corrected, internally their accounting and the numbers, but that never got out to the public. So there was, in effect, a misuse of information at the higher levels of leadership in the state beyond the department. So in effect, the department, from my perspective, had a responsibility to get the real story out, and they seemed unable to do that.
The comptroller now providing a list of recommendations to fix some of these issues.
Part of what we really talk about for the executive, for the governor's office, is that they really need to examine how communications are handled and make sure that data and information is not manipulated to put a narrative out there that's contrary to the facts.
The DOH says it appreciates the goals of the audit, but doesn't agree on all of its conclusions. Former Governor Cuomo was in office during a majority of the time of the audit. His spokesperson saying, quote, "As the number of out-of-facility deaths were reported last January, this is not news. However, what is peculiar is the comptroller's release of the audit now, but no one has ever accused him of being above politics." Stephen Hance, president of the New York State Health Facilities Association, says Governor Hochul's proposed budget invests in long-term care, and he believes it will help reverse years of disinvestment.
Caring for our elderly and most vulnerable is a partnership. It's a partnership between providers and government.
Reporting in Albany, I'm Jamie DeLine.